best way to do something is kind of the simplest way to do something, and the device makes daily QA very simple.
Hi, my name is Tracy. I'm the Thought Leadership Manager and podcast host here at Standard Imaging. Today, I bring you notes on the QA BeamChecker Plus from Justin Keister with Aurora Health. Without any further delay, let's get started. Hello, everyone, and welcome to the first in our product review series. Today, I have with me Justin Keister. Justin, would you like to introduce yourself?
I'm Justin Keister. I'm a medical physicist with Advocate Aurora. I've been a medical physicist for about 20 years. I finished my master's in, I think, 2001, and I'm a graduate of the University of Kentucky.
Thank you. I know things are incredibly busy there for you, and I certainly appreciate you taking time out of your day to come on here and chat with me a little bit about the QA BeamChecker.
I've used the BeamChecker for, probably 15 to 20 years out of my career. So I have a long history of using the device, many different accelerators, and had a lot of success with it.
What do you find easiest or what do you like most about this device?
Well, I think, as a physicist, I think one of the things that we look for are obviously devices that perform the function that we're looking for, but also perform it in a way where there's not a lot of maintenance, especially a daily QA device that is something that we use in the clinic every day, every morning on the accelerator. It's the one thing that I love about the device is that it is a easy to use device. It doesn't require a lot of maintenance. It's fairly intuitive. So our therapists are able to use it very easily. There aren't a lot of questions. There aren't a lot of instances where I have to intervene to help or check with the device. Once you set it up, it operates on a fairly regular basis without a lot of physics intervention.
You had mentioned also that your devices come with a wireless option. What benefit do you see there?
I think everybody who has a Apple or an iPhone charger would understand that, anytime that you plug something in, you have the potential for, a point of failure, so to speak. And the one thing that I feel is one of the best features of the BeamChecker device is that it comes in a robust cradle with the wireless device. You pull it out of the cradle every day, you put it under the beam, you take your measurements stored in the firmware in the device, and then you place it back in the cradle, and the cradle is what is somewhat permanently connected to the computer. So you're not plugging in and out cord or cable to a port on a device every day. It's literally just a cradle, and the device sits in there. It's a fairly robust connection in the cradle, and then basically it picks up and reads the firmware and reads the measurements and the data every day. And the software it gives you a green button that basically says new data found. Click on it, shows you what it measured, plots it out for you.
Sounds like an incredibly easy addition to your QA portfolio. Do your therapists have any feedback regarding using the QA BeamChecker on a daily basis?
Once the baselines are measured for each beam and the rooms are set up on the device, it just becomes a real standard part of their daily warm-up. We have a standard plan that is set up on each accelerator with known table positions. We know exactly where the device is supposed to go. We set it up. The therapists go in, they measure each beam on a daily basis. They take the device off the cradle to measure it. The nice thing about the device is electrons are on one side of the device, photons are on the opposite side of the device. So it's just to measure the different modalities of electrons, photons. You just have to flip the device over a couple buttons, and basically they take their measurements, they put the device back in the cradle, and they move on with their day. With the evolving QA processes, with daily QA has to be done for, checking your beams in the morning. It has to be done check your imaging and the accuracy and precision of your imager. Also, QA also involves surface guided systems now on most accelerators. With all of the evolution and the advancement of modalities within radiation therapy with image guided therapy, I feel like the best way to do something is kind of the simplest way to do something, and the device makes daily QA very simple.
Sounds like a time saver.
In my 15 years of using the device, I've used other daily QA devices. I feel like once we made that switch over to the BeamChecker device, it's a device that makes the work so easy that it would be a hard time to switch to another device at this point.
All good things to hear. Thank you. Thank you so much for sharing your insights and opinions about working with the QA BeamChecker. I certainly appreciate you taking time to do that today.
Oh, thank you for your time as well.
Absolutely.